Dr. Shannon Clark here. I am an OBGYN and MFM, and we're going to talk about this person's video. When someone questions your choice for an elective C-section, you know we're going to chat about it. Now, what she's referring to is something that is known as cesarean delivery on maternal request. And that is when a cesarean section is requested by a person who has never had a cesarean section before, and there's no medical indication. Although some would argue that a patient's desire to have a cesarean delivery is an indication, right? Shouldn't patients be able to decide that they want a cesarean just as they could decide that they want an SVD or an epidural or not epidural? I can tell you where I work. If a patient requests a cesarean delivery on maternal request, meaning that for cesarean delivery without any technical medical indication, if you will, and we counsel them about the risk and the benefits and they still want it, we do it. Now, this can also be referred to as an elective cesarean delivery, not to be confused with an elective repeat cesarean delivery. An elective repeat cesarean delivery is in someone who has had a prior cesarean delivery and they're electing or opting to have another cesarean delivery in the next or subsequent pregnancy. Now, I do think that anyone who is requesting a cesarean delivery on maternal request should definitely be counseled about the risk and benefits. Absolutely. Because sometimes you might uncover some concern or underlying fear that the patient might have that's preventing them from attempting to have an SVD or just undergo labor in general. Now, with that being said, if after counseling the risk and the benefits, the patient still desires it, it should not be done prior to 39 weeks. Hard stop. Another thing that should be discussed is what the patient's plans are for how many deliveries they want in the future, because every cesarean delivery increases the risk of placenta previa, placenta accreta spectrum disorder, and the need for undergoing a hysterectomy during a cesarean delivery later on with other births. So let's hear it in the comments. Did you want to have a cesarean delivery on maternal request? Did you get it? Were you given a hard time? Let's hear about it.